Good afternoon, everyone. Happy Friday. Thank you for joining this session. We have our speaker, Brigadier General Dr. Lawson, who will be presenting why the prospects have to choose Texila American University to study Masters of Public Health. Dr. Lawson, over to you. Thank you.
Thank you very much, and thank you for having me. Just give me a few minutes. I'll be starting my presentation. So today we'll be looking at why enroll and study for the Masters of Public Health. Or indeed, why should we become public health practitioners or public health specialists? To make this presentation, I am Brigadier General Dr. Lawson Simapuka. I'm a Chief Academic Officer and the Dean of the School of Public Health. In terms of the presentation, we shall follow the following order. We'll look at public health as a science and art, purpose of public health. Then we shall look at the components and subfields of public health. We'll look at the degrees in public health, and then we shall zero in on Texila American University Masters of Public Health program. So by definition, public health is both a science and an art. And the sole purpose of this science and art is to prevent disease, prolong life, and promote physical health. And how is this done? Through organized community efforts, looking at sanitation of the environment, control of community infections, health education to individuals, and the principles of personal hygiene. And this is done through medical and nursing services for early diagnosis, prevention, and treatment of disease. So this is a definition as defined by public health, as defined by Winslow, 1920. There's been very little change over the years. The basics are the same. So what is the purpose of public health? There are basically two purposes of public health. The first, riding on the definition, the purpose of public health is to come up with interventions to prevent and mitigate diseases, injuries, and other health conditions. Secondly, the overall goal is to improve the health of populations and increase life expectancy. That's the reason that in communities, or indeed regions where there are very strong public health systems, individuals that live in these regions or communities tend to have a very long life expectancy. When we look at the field of public health, the field of public health has core components and subfields. Among the core components are the basic health sciences, public health sciences, and policy and management. These are the core components on which we ride to apply necessary interventions in public health. So when you look at basic public health sciences, we're talking about epidemiology, biostatistics, social sciences, and scientific methods and research. Then we have policy and management. Interventions, operations in public health are guided by the health policy, public health policy, and then in the carrying out of public health activities, you cannot do without having well-managed health services. And indeed, we look at the aspect of financing health, which is health economics. These are the core components of public health. Then we have the subfields which fall in application. We have global health, looking at health at a global level. If you look at the SDGs, we are talking about health SDGs to be achieved by 2030 at a global level. Disaster preparedness, occupational health, education and interventions, applications in a workplace to ensure safety of the workers. Environmental health, we are talking about both physical and built environment. Very important in managing the health of a community or indeed individuals. The physical environment has a lot to do with the spread of diseases, just as the built environment has to do with the health of individuals. Imagine if one lives in an environment where there are not well established streets, roads. It will be very difficult for individuals in that environment to even go for a jog. And in such an environment, you find that individuals will tend to be unfit, which is a negative on the individual's health. Then we have issues of maternal and child health, sexual and reproductive health, health promotion, health education, very important. Community health, looking at interventions at community level to promote health. Then the issues of mental health, and of course, health politics. How do we look at facilities? Which facilities do we fund and in what quantities? What are the degrees that are offered in public health? For non-medical personnel, that is, those individuals who are coming outside the medical field, there's an option to start as a school leaver. And the entry point is a bachelor's of public health. Then you are riding on a career in public health. Then we have individuals that are coming from other health professions. These individuals have qualifications in other health fields. But for you to be an accomplished clinician, an accomplished nurse, environmental health specialist, biomedical scientist, it's very important that you have a very strong background of public health. The public health degree is a working degree that facilitates work across the health profession to be achieved in a very effective and efficient manner, because you will be strong in the area of research, you will be strong in the area of administration. As you zero in your core profession, you may be a biomedical scientist, a nurse, pharmacist, or indeed an environmental health scientist. So, in as far as the master's program is concerned, which most of those that already have their basic degrees would enroll in, there are basically two master's programs. So an individual can, at postgraduate level, study for a Master's of Public Health or a Master of Science in Public Health. Upon achieving either, one would proceed to pursue a Doctor of Public Health degree or a Doctor of Philosophy in a subspecialty of any of the public health disciplines. So what is the difference between an MPH, DRPH, and MSPH and PhD? The difference is that one is professional. An MPH is a professional degree. It allows you to operate in the field, carry out interventions, and indeed manage health facilities in an efficient and effective manner. So it is a working degree, a professional degree to run health facilities, zeroing in on public health interventions to prevent disease, promote health, and indeed prolong life. Now, on the other hand, the Master of Science in Public Health, this is an academic degree. It's for individuals that would love to spend their time in academia, conducting research, and indeed mentoring students of public health. So these are the individuals that zero in into the studies of a Master of Science in Public Health, or indeed a PhD in Public Health. So what does Texila offer? We are offering a Master's in Public Health, which is a professional degree. When you look at the MPH that we are offering, why choose Texila? Texila is a Tier 1 university, recognized in Zambia, Sub-Sahara, and at global level. In Zambia, it's ranked as one of the best, the topmost private university, Tier 1. And of course, there's regional and global recognition, and that's the reason that Texila American University Zambia has students cutting across the board. In Zambia, in the sub-region, North Africa, and indeed some of our students are on the other continents, Europe, Australia, indeed the Americas. The other reason why you should choose Texila to study your MPH is that we have highly trained faculty, both medical doctors and paramedics. Some of them who have more than 30 years experience in public health, more than 30 years of experience in the field of academia in public health. So you can see that in such a scenario, excellent facilities, infrastructure, equipment, and indeed the support personnel. It makes Texila a natural choice for you to come out as a well turned out public health practitioner, or indeed public health specialist. So our Masters of Public Health program is run on a DBLP model, distant blended learning program. It's a 2-year program, and the pattern of the program is on a trimester basis, meaning that at the end of the 2 years, you would have gone through 6 trimesters. And to make sure that you are well grounded, you come out as the practitioner that will be able to say that one will be able to carry out the profession in the field at a facility without any problems. We've designed the trimesters in such a way that in each trimester, you only take 2 courses. And then to strengthen learning, we conduct contacts classes on Saturdays, which run from about 10 hours Zambian time to 12:30 hours Zambian time. And it's a requirement, an academic requirement, that we have 75% attendance from the students. At least each student should have a minimum of 75% attendance of the lectures that are given in each of the trimesters. This is from a background that, from research that has been conducted, attendance does promote learning. It does promote deep learning as opposed to surface learning. And this attendance applies both for the lectures and forum discussions. So, how is the Masters of Public Health program delivered? Texila American University is very strong on the e-platform. And that's the reason that even when we had the COVID crisis, it was very easy for us to transform from on-campus classes onto the virtual platform. So we have a well-designed learning management system on the e-platform, which is both an academic and an administrative platform. And from the LMS, there is resource material which the lecturers use in the contact classes. So PowerPoint slides are uploaded on LMS, which the students can access also. Then they are reading capsules, basically notes. And then there are links to e-libraries, links to audiovisual tools that can be used by students to promote effective learning. We don't end at having contact classes only. We also have faculty-student interactions. On LMS, there's a slot student to book and interact with their lecturer, looking at an area in the field of study where maybe they were not clear, so that one-on-one, the lecturer will be able to explain. The interaction don't just end with members of faculty. The students also have a chance to have one-on-one discussions, either administrative or indeed academic, with the dean of the School of Public Health every Friday. Then in each of the trimesters, for each course, there are case studies. Then on completion of each unit in the module, there are 4 modules. Then each module has 3 units. At the completion of each unit, there are MCQs, about 5, or indeed 5 MCQs, which a student has to attempt. Then in the second trimester and fourth trimester, there's what is called a capstone study. A capstone study may be termed, for easy understanding, it's more or less a mean research, a pilot study. So you could have covered some courses. For example, you've covered environmental health, epidemiology, and introduction to public health practice. So you look at these fields, the courses that you have covered, and then you look at the theories, phenomena, rules and regulations that you have acquired, and then apply that in your work scenario, and then come up with a capstone report, which takes the exact formatting as a research report. Then there are forum discussion questions, which are uploaded on LMS, which students contribute to. For example, we would throw a forum discussion question on LMS about COVID. Students should contribute to the question, why is it that there is low vaccine uptake amongst public health practitioners? Students will contribute from a critical and an analytical point of view, and then an assessment is made. So the MCQs, case studies, capstone studies, forum discussions form the continuous assessment. And then at the end of each trimester, you have an external assessment or summative assessment, and that is conducted by administering multiple choice questions. Once a student passes, then they progress to the next trimester. Yes, you have chosen to study for a master's of public health. When you graduate, what are you going to become? If you're a physician, a medical doctor, a public health physician, then you may go further and zero in on specializing in epidemiology, even epidemiologist, biostatistics, biostatistician. Then overall, you may venture to be a researcher. with your field of healthcare management, strong in epidemiology, strong in research, health economics, you definitely qualify to become a healthcare administrator. If you're a nurse with your master's, then you come out as a public health nurse. Then some of us may go into managing of public health projects. So you qualify to be a public health project manager. Then you may go into health informatics, and you can be employed as a health informatics specialist. Or indeed, you'll be deployed in a hospital or an organization, an NGO, or in a ministry as a healthcare consultant. So there's a wide range of opportunities for all of us that go through the Masters in Public Health program, especially program offered comprehensively from Texila American University. Then once you're a graduate of public health at master's level, there's no conference where you will go and you fail to understand what's going on. Sometimes we get into conferences. They are presenting research findings, but if we are weak in epidemiology, biostatistics, whatever will be presented may look strange and we may not understand. They will be talking of p-values, confidence intervals, tests of significance. If you have never been a student of public health, it will be very difficult for you to understand. Even when the confidence intervals are presented, you may not differentiate whether the confidence interval is narrow or wide, or if it's narrow or it's wide, what's the implication? You may not understand at what level does a p-value show that there's a difference between two interventions, or indeed the difference is just happened by chance. Such kind of knowledge, as a scientist, can only be acquired if you have been in a class of public health at a master's degree level. So you are enrolling or you intend to enroll into the Masters of Public Health program, you're not making a mistake. Once enrolled, you graduate, you become the perfect practitioner that you're supposed to be it a physician, nurse, environmental scientist, biomedical scientist, or a pharmacist. You'll be cross-cutting and very strong in your profession. So I thank you for listening to my presentation on why choose MPH with Texila American University. I thank you all, and may the good Lord bless you.
Thank you, Dr. Lawson. It was a wonderful presentation. So I'm sure that the prospects who were not able to make for the day will be definitely given an opportunity to receive this wonderful presentation on why someone has to choose Masters in Public Health. And moreover, the topic was not only limited only to highlight why someone has to choose Masters in Public Health, but also it has covered the vast field of what does Masters in Public Health does in one's life. So thank you so much, Dr. Lawson, for your wonderful insights and presentation. I'm sure that all these are because of the vast knowledge and experience what you have in this field. Thank you so much for the wonderful session, sir.